Hello everyone. Welcome once again. And today again we have one of the NEET SS critical care medicine group toppers with us, Dr. Vaishnavi, who has done splendidly well in the recently concluded NEET SS. She has secured rank 20, and Vaishnavi is basically from the same institute that I am from. She also did her MD from AIMS Delhi. She did her MD in emergency medicine, and now she is doing a senior residency there. And now she's secured a rank of 20, right? In
Yes,
NEET SS critical care medicine group. So, huge congratulations, firstly, Dr. Vaishnavi, from
thank you
all
so
of
much.
us. So, how you're feeling right now, and what are your plans going forward?
So I feel very happy that I have bagged this rank this time itself. And yes, I'm very excited to start my DM or DRNB, whatever I'm planning to join soon. So yes, I'm pretty excited. Yes. Thank you so much, sir.
So, just tell me about a bit about your background training, like your MBBS, and you did your MD. So, what has been your growth or your pathway till now?
So I have done my undergraduation or MBBS from AIMS Raipur, and after that I have joined MD Emergency Medicine at AIMS New Delhi, where I did my post graduation, and then I have completed 3 years of my MD there itself, and after which I joined as a senior resident in emergency medicine at the department of AIMS itself, and I'm through 2 years of senior residency, and now I have written the NEET SS 2024. Yes.
So, actually, like I was telling you before as well, a lot of people we interview, a lot of people are from anesthesia background or sometimes from medicine background. So, you're the first one I'm interviewing who is coming from emergency medicine. I know people from emergency medicine are also waiting for DRNB. So, it would be quite interesting for us to know, like, being from an emergency medicine background, some of it is obviously acute care that you deal with regularly, maybe in the ER, but some of it might also be a bit different in terms of critical care. So, how did you actually prepare for the exam? When did you start preparing? When did you start to decide that you want to pursue critical uh, specialty or a super specialty, as we like to call it here?
Yes, sir. So, like, thought of doing critical care. It was going on in my mind since 2 years. So that's why I prolonged, like, soon after I have done my MD emergency medicine, I was thinking to go for DM critical care, but still I wanted to explore emergency medicine itself because that was a newer branch in itself. So I thought of continuing my senior residency for the experience. But then later on, when it's been, I think, 7, 8 months since I have completely thought of doing critical care medicine, that I had decided to completely join critical care medicine. So I think 7, 8 months down the line, I have decided and I started my preparation.
So, like, having done some postings in emergency medicine during my AIMS tenure, I know that emergency medicine is one of the most like hectic and brutal of all the specialties that are there in AIMS. Especially the night duties, I remember they were like superbly brutal. Like, we would not get to even sit at times. So, how did you actually balance your work and your studies, and how did you actually prepare for it once you decided that okay, I'm going to at least appear for the exam and try to pursue this?
Yes, sir. So actually, it's exactly completely like you said. Since your time only, it has been the same, sir. And now the patient load has, I think, increased exponentially. So even although the duty hours were limited, but still I was completely exhausted as soon as I used to come back. But I think I was able to dedicate few hours after my day shift and my evening shift. So probably around 2, 3 hours. But I would say that, like, the most of my preparation, like the best of my preparation, I had given in the last 4 months. So since November, after the notice got released in October 2024, I then decided that yes, these were my 4, 5 months which I have, and the last month I kept only for revisions, mostly. And the 4 months, that November, December, Jan, and Feb, were the 4 months I completely dedicated. Yes, it was very hectic with the shifts and everything, but somehow I could manage some 4, 5 hours of study every day. So
Great, great. So, like, what was your strategy in terms of your preparation? Like, did the Marrow videos or whatever Marrow offered to you in terms of critical care, did it help you in some way in your preparation?
yes, so definitely. I think Marrow has also played a huge role in my preparation because me coming from an emergency medicine background and like closing, meeting somebody close to critical care was very few times. So because yes, we were posted in ICU and other places, but yes, our ICU exposure per se was limited. Although we do deal day in and day out with critically ill patients, but I feel that the amount of time that they are with us in the emergency department is limited. So that is where I felt that it would be a huge lacuna if, since I do not have an ICU background in the first place. So yes, all your videos, sir, I have gone through once. So I understood in the first, like the first time I played the videos, I understood that what were the topics that were actually going to be asked in the critical care medicine in the NEET, because this was the first time I have given my NEET SS exam. I haven't given it before. So I did not even have an idea what kind of questions would be coming up. And since the notice was released that the entire paper is going to be of critical care medicine only 100%. So then I decided that, yes, I need to know what actually critical care means and what is the syllabus that is going to be asked. So after going for the first time, going through your videos, I understood what all topics were actually going to be concentrated on. So, like, I have almost in all the topics, like the infectious diseases, the cardiovascular care, the hemodynamic monitoring, those were all like something that you have really explained very well, that I felt that it has filled up my lacunae, sir. So I feel the first batch of videos that I watched was gave me a rough idea. But then when I revisited those videos, that was when the concepts have grown stronger. And then I have also referred OS manual and like to the topics where I felt that I couldn't get it at the first place. So yes, it really helped me a lot, so I would say.
And did you appear for any of the, like, did you solve the MCQs along with them? Did you
Yes,
appear for mock tests as well?
yes, I have completed all the videos and I have completed all the question bank. So, yes, like I was pretty thorough. Like from the beginning only, I was very thorough candidate. So I thought of utilizing it to the fullest. So I did complete the entire question bank. So I felt that question bank was very tough initially, but then as long as I was able to cover the videos and I could have a self time for reading, I understood like what kind of questions are going to be asked. And the test series also really helped me, because the test series also culminated questions which were easy, and which were like part of which were easy, which I understood that doing a silly mistake in questions that are going to be easy is going to pay me hard time. So that was one thing that I understood. And I also understood like the question paper, that the test series that Marrow offered was really really helpful, because I felt that the culmination of questions were easy to hard, and in between there were medium kind of questions which were like doable with revision. So, and the tougher part, the questions which were not covered in the video lectures and in the question bank were those questions. So then I could understand that these were the topics that I need to build on. So yes, sir, that was really helpful.
So I generally keep on telling people to, like, you make your own notes, because obviously read some of the notes. And then I keep on telling people for reinforcement, it's a better idea to prepare notes. So did you rely on the notes as well, or is it just you prepared
Sir, I
notes? And
prepared my own notes. The entire lecture videos of yours, I have completely noted, jotted down all the points by myself. I've always been that candidate. I don't know how much helpful it would be for everybody else, but I have always been a candidate who would read from their own notes. So I have jotted down all your lectures into the notes. And although Marrow did offer the notes separately, which were handwritten notes, I did refer, but I felt that those were really helpful, which I have written. And I have also like used to add on from the question bank, from the test series, I used to add on the points. So,
yeah, because I keep on telling people that you should make your own notes, because at the end of the day, if you write
yes,
it in your own notes, it causes a reinforcement for the brain, and then you tend to
yes, sir.
remember.
It is easier to revise, and
It's
yes,
much easier to revise as well. The other thing I think probably that helped you and helped many of the people as well, like especially people from anesthesia background, and was they changed the question pattern, right, this time around. So they kind of focused everything on critical care, and
critical
basically
care.
they're all critical care. They don't really deal with medicine per se. So obviously we try to cover critical care in as much depth as possible. So obviously the questions from critical care will always be you at an advantage. Maybe till last year, questions were from medicine. So it was like a bit of an unequal field for a lot of people, right? So how did you find the question pattern generally? Like, because you appeared for the exam, right? And we don't have really a recent hint of will get question back.
I did find that the paper was like, sir, I would say that almost 80% of the syllabus was pure critical care, I would say. 80 to 90% I would cater. And out of which, yes, emergencies were also given some importance. Like there were some arrhythmias that were asked, there was some toxicology that was asked. So I think 20-30% of it, but also that also constitutes under critical care. So I would say 80-90% was completely critical care. Some of the images that I felt and some of the signs that I felt were from my pre-PG preparation that helped me, but I did not really like went back and read all of that. But I think those were solvable questions if you have really like studied in your pre-PG time. Then I don't think you need to even go through your notes of pre-PG preparation at all, because 80-90% was completely critical care, sir.
So, if you had to sum it up, your preparation, if you had to give an advice to people who are going to appear maybe in the coming months for the next sessions, especially from an emergency, like from somebody who has graduated from emergency medicine. So, what would be your, or even generally, what would be your advice to them, like how to go about it in terms of the preparation?
So I feel that I would recommend everybody to start, I think, way before, because I feel that the time that I catered for my second and third revision was very less. So that is one thing that I would say that it will help. It will be helpful for everybody. And always whenever you start earlier, it is always better. And also like cover everything, because I felt that the videos build the basics. Like I mean to say that solving just the question bank or just the test series is one part, but videos definitely from an emergency medicine background, PA catheter, ECMO, and hemodynamic monitoring are the things that we never do. Like we have never seen, or I have never seen also. So that is something that is very, very new. So I feel that going through the videos, watching through the lectures, you will understand what are the topics you need to emphasize on. Second thing is going through the entire question bank, because I feel that there have been a lot of topics that have been covered in the question bank itself, and giving all the tests is also very important. So I think comprehensively doing the question bank, doing the videos and the test series are going to help a lot, rather than just choosing one of it, I would say. And also, like I did refer to some of the standard textbooks also. I just it was just an add-on, and I would say that standard textbooks, I would say that some of the topics are really good, nicely given in the standard textbooks. That I would say you can, if you have time, you can still cover, since you are starting, you're going to start early. Otherwise, in the last 2 months, I think only revision is what matters the most.
Like you mentioned, O's manual again is a very nice textbook.
Yeah, very comprehensive. Yes, so it's like.
So I have never read it, to be honest with you. Like
So actually, I had to go through it because I was like, some of the topics were so new, and I was like, I need to cover it like comprehensively. So only some of the topics I did refer to that from that. So
just read Washington Manual if you like, because
yes,
I feel it's a very condensed kind of a book. Because Arvind Rippy or other books, I don't say, because I know that it's not possible. Like when you're preparing for a NEET SS, it's not possible to kind of. But then O's is a good book. I know a lot of people.
yes, sir.
I read, but a lot of people who cleared the exam with me, a lot of them, they actually studied the O's manual, and all of them said that it's a good book. And like you were saying as well, so definitely it's a good book. There's no doubt about it.
Washington
So
Manual, sir, is definitely one of my favorite books, because in emergency during my MD, I used to read it because it really helped summarize a lot of topics. So I felt that.
yes, absolutely. So, like, what would be your suggestions to us, like going forward? How can we improve on whatever we are providing to the subscribers? Like things that you would want us to improve, or some things that you would want us to add, maybe which was not there this time around.
Okay, sir, I think like most of the part was almost covered in the the Marrow lecture videos. I would what I felt that could be added on was something more on nutrition. That was one thing, because I felt that from somebody like from an emergency medicine background, focusing on nutrition is like never a part for us. Other than that, I felt that everything else was nicely covered. Like, sir, and something on the ECMO, sir. I feel that ECMO videos can be added. Only these two I felt that would be, because I think people who are not routinely even able to see ECMO and all, so I think for them it will be very, very helpful, sir. So
Yeah.
I think
So
only
basically, I was planning to add an ECMO, like a few lectures on ECMO going forward. The reason I didn't add ECMO at that point of time was because I felt that the other lectures would be, or the other topics would be more like high compared to like maybe there might be one question from ECMO, and even if people do not answer that, it's not really going to change much. So I kind of went over ECMO while we were discussing ARDS or maybe cardiogenic shock in bits and pieces. But yeah, maybe that's a good suggestion. Maybe we will be adding some lectures on ECMO going forward.
Yeah.
For the
Other than that, rest of everything was very good, sir. Like I think hemodynamic monitoring was one of the lectures that I felt that was really helpful because there were a lot of questions on hemodynamic monitoring. So
right. And anybody, like, I think that would be the final question. Anybody would like to thank for your results? Like, obviously, you were the one who actually did the most of the work, but obviously there might have been family and friends as well, right? Who would have,
So I would like to thank my parents, especially my mom and my brother, who has been a constant support, and my friends. Yes, sir, I would like to thank all of them. So,
so I obviously you do not know the seat matrix yet, so I would ask you about what, but obviously you are at it in a sentence with your rank. There's no doubt about that. So from Marrow, we would like to wish you all the best for your future.
thank you so much.
And maybe we'll meet in some conference or some workshop.
Definitely, sir. I'm looking forward to it.
It was great hearing from Dr. Vaishnavi.
Thank,
Congratulations once again. And
thank you so much, sir. Thank you, sir.